Welcome to our second episode of Navigating Today's Normal, the Connected Mind and Body. Today, Dr. Stephanie Palmino is going to talk to us about the importance of social connectivity and loneliness. In times like this, isolation and stress create the need for us to maintain new friendships and social connectivity. Social isolation and loneliness left unattended can create serious risk for depression and a host of other physical and mental health concerns. Importantly, she's going to give us a lot of ideas of how to stay connected and in touch when we can't physically get together. Stephanie holds a doctorate degree in nursing with specialized medical and mental health credentialing, including a bachelor's and master's degree in gerontology. She is certified in public health, case management, and is a dementia practitioner. She is currently the president of CT Nurses Association. Stephanie is also the CEO of Global Health Systems, a public health consulting firm, and also chairman of the Patient Is You Foundation. She is a board member of the SWCAA, which stands for the Southwestern CT Area Agency on Aging. As a result of her substantial academic and professional experiences, she also serves on numerous state and regional boards as well as advisory boards.
Hello, my name is Dr. Stephanie Palmino. I'm a public health nurse, and I'm currently the president of the Connecticut Nursing Association and the chairman of the board of the Patient Is You Foundation and a member of the Southwestern Connecticut Area Agency on Aging. And I've been asked to speak to you today about COVID-19 in regard to the risks for social isolation and depression in seniors. So that's what I'm here to talk to you about. And part of my background included a large chunk in psychiatric care as the director of a regional state mental health hospital in New York. So it's a background that I have. What I'm going to cover when I talk to you today is the defining the terms, particularly around what social isolation is, loneliness, depression and anxiety. I want to talk a bit about recognizing the warning signs because that's so important that people be able to know what might be a clue to them that they're heading down a troubled path. I'd like to talk about the difference between being alone and feeling lonely and who's at risk for that. People have different risks for different reasons. I want to talk about the health impact of isolation and also to end on a more positive note about how you can develop coping mechanisms and use coping mechanisms, and I have some resources for you at the end. Social isolation can lead to some really devastating impacts for people, and these can cut across the areas of health, mental health, your ability to think clearly. It affects your immune system, all kinds of facets of your quality of life, right down and up to and including your absolute mortality and suicide rates. It can impact relationships you have. It actually even affects your genetics, which I think many people would find surprising, but that's evidence-based science behind that. People's perception of pain is altered by social isolation. How you eat or don't eat, the way you adapt or cope. And unfortunately, a lot of people turn to the use of substances to help with coping, and that's not a productive way. So we want to talk about some other ways that might be more productive. There's an evolutionary theory of loneliness, and loneliness triggers so many things inside a person that are both behavioral and biological, and these processes contribute to loneliness and premature death. And again, this is something that there's evidence-based science behind, so it's not just a comment being made, it's something that we can support with evidence. So going into defining the terms, social isolation really refers to people who have limited social relationships, few social contacts, and this can be by choice or by circumstance. In the case of COVID-19, we are all in a state of some degree of social isolation. But I'd like to point something out to you and ask you to consider it. If you look at socially isolated people, and so many surveys have been done on this over the years, a quarter of all the independently living seniors report that they are being socially isolated pre-COVID-19. However, 43%, that's almost double the number of people who report being socially isolated, report feeling lonely. So what does that tell us? It tells us that even if you're not isolated, you can feel lonely. and we talk about people being lonely in a crowd. That may be what we're looking at here. The next two things that I wanted to define was loneliness and depression. Now, loneliness is a feeling, and I think many of us have probably experienced feeling lonely. But it's a feeling that results from the feeling that you're alone and isolated. And one can always ask themselves, are you truly alone and isolated, or is that just the way you're feeling? Depression. How many of us say, oh, we're feeling depressed today, when they really mean they're feeling blue? We all have days when we feel down, a little down in the dumps, a little blue, but depression is actually a diagnosable mood disorder. And a mood disorder, a clinical depression, which is what we're talking about here, is something that affects how you think, how you feel, how you act, and how you react. So in clinical depression, if you were to be sitting before a doctor or a primary care provider of some other sort, what they're going to be trying to ascertain from you is how long have you felt that way? How much of a day do you feel that way? How many days in a week do you feel that way? So to be clinically diagnosed with clinical depression, you have to have had those symptoms for 2 weeks. They last almost all day long, and they last almost, or I should say most days within that 2-week period or longer. And if you've ever been depressed, it's a feeling. For all the years I spent in psychiatric nursing, I thought I knew what it was to feel depressed because I worked with so many people. But just to give you a little sharing of an account, there was an episode in my life when my husband was diagnosed with the worst kind of pancreatic cancer. Turned out not to be, thank God. But that put me into a depression. And if I thought I understood what depression was before that, it was very clear to me that I had no idea all the years I spent working as a psychiatric nurse, because it is overwhelming. But the message that I want to give to people is that nobody has to stay in a state of depression. There are very effective medications that can treat it. There are treatments people can go through. So the key message I want from that slide is that you be aware that it's different from feeling blue or having a down in the dumps day, and that you don't have to remain that way. Okay. There are ways to avoid or combat depression, and that's really important. You can reach out for help. There are all kinds of ways you can do this. You can talk to family or friends, people who you feel comfortable with, let them know that you're feeling down, that you're having a bad day, that it's not going away, it's lasting, what kind of thoughts you're having. You can discuss this with your primary care provider. In fact, when somebody's going through any type of an assessment for a mental health issue, we always suggest that they start with their physician, their nurse practitioner, their physician's assistant, because you want to rule out things like physical problems that can make you feel that way. Depression comes along with medication reactions and other kinds of illnesses. So again, that's a really important place to start. You want to stay active, even if you're not motivated to be active. Even something as simple as taking yourself out for a walk, walking your dogs, can have a major impact on helping you to feel a little better, even if you don't want to do it, if you can force yourself to do it. And that is hard, because if you're in a true depression, you don't want to do anything. So you have to kind of talk yourself into it. You can try and stay connected. And here I'm talking about ways to avoid. Try to stay connected. And how many ways are there that we can stay connected in this day and age? You can stay connected on the telephone, through social media, through writing letters to people. My mother-in-law, before she passed away, came from Italy and grew up in Italy. She loved being on Google Earth and traveling all around the places she grew up. And then she met networks of people who were doing the same thing. So there are all kinds of networks and groups that you can pull together around social media. Okay. There are hotlines if you're actually feeling depressed or concerned that you're depressed or worried that something is wrong with you at this moment. There are all kinds of hotlines you can call, and I have them listed in the resources. There's telemental health. You can call up psychologists, social workers, your physician, and they'll talk with you online, kind of like we're doing right here. You could have somebody in your computer screen who's actually talking specifically to you and having a two-way conversation. There are all kinds of online counseling venues where you don't actually have to be talking with the person, but it's more like self-help kind of things. There are groups that run by telephone and through social media, so there are many opportunities for people to get help. And people people will be more comfortable with different levels of help, depending on who they are, and their comfort with social media and computers and things of this sort. A lot of our older folks, and I can say this because I'm one of us, is that we're not always as comfortable with the social media venues as some of our younger citizens are. At this point, I'd like to talk about anxiety. So anxiety is a reaction that we have, and it's a reaction that we have to fear, either fear that something is a threat to you, to a threat to your well-being, and that may or may not be true. But as we say, perception is reality. So if that's what you're feeling, anxiety is the common reaction to that. Now, I'm a strong believer in a therapeutic intervention that's called cognitive behavioral therapy, and I wonder if you've ever heard of that. I love it because any one of us can do that. You don't have to be in therapy to use cognitive behavioral therapy approaches. What the premise there is that if you can change how you look at something, you'll change how you react to it. And an example of that would be if you are worried about dying of COVID-19 or losing a loved one to COVID-19, you can remind yourself that about 80% of people who come down with COVID-19 are going to recover from it. You can remind yourself that even though those of us in the older age group have a greater incidence of being more severely ill and succumbing to it, we still have a great rate of overcoming this. So if you can think about it in that different frame of reference, you can perhaps change how you can react to the overwhelming nature of feeling you're going to die or someone else is going to die. Okay. So there are also ways that you can reduce feelings of anxiety and depression. And I mentioned before physical activity. It is such a great way to support your emotional health. And when you're doing anything active, it releases endorphins, and you may or may not know that endorphins are the body's natural pain remedy, and it's a remedy for not only physical pain but emotional pain. So physical activity is a great thing to be involved in, and you can do that at different levels of degree. I talked about going out for a walk. You can walk your dogs, you can walk by yourself, you can do weightlifting, and if you don't have weights, you can use cans of soup, you can use things in your home to get physically active. You can be engaged with people on the computer, on telephone groups, and all kinds of things. People are doing marvelous things today because sometimes when you're exercising, doing it with other people is a plus. You have a little more motivation. And I think it's important to remember that you're more likely to stick to something if you set yourself some goals. So if you tell yourself again that you're going to exercise every day for 10 minutes, then do it every day for 10 minutes. Set yourself a schedule. Another thing that's happening to a lot of people, not only during COVID-19, but during all kinds of disasters and emergency situations, is a lot of people turn to excesses of alcohol, caffeine, sugar, including drugs, smoking, things of this sort. You do well, you'd help yourself tremendously well if you can avoid excesses of that. And that doesn't mean being a teetotaler. There's a great benefit to people having one glass of wine a night, one drink a night. That was one of the first things a doctor told us in nursing school, is that having a glass of wine a day is a healthy thing. Now, if you have an alcohol problem, I wouldn't do that, but you can do other things. So again, avoid excesses of alcohol, tobacco, caffeine, sugar. Some people are using medicinal marijuana and things of this sort. There's very little evidence behind a medicinal use to that in most cases. But a COVID-19 time when you're feeling anxious or depressed, you might want to discuss with your doctor or your nurse practitioner what they think about you using that at this point in time. Stay connected with your friends, stay connected with neighbors and family members and social groups. If you have grandchildren, correspond with them. You may learn new technology things. I know a lot of seniors who are doing that today, becoming quite adept at things they never touched before. So there are ways to challenge yourself. But all of those involvements help to reduce the feelings of anxiety and depression. Your faith-based group is another place to go. A lot of religious services are being held online. And even on the beach in some cases where you can't go sit in a church, but maybe your service is being held outdoors. There are also ways to reduce feelings of anxiety and depression in different ways. You can set the stage for a restful sleep. You have to set the mood. Now, I rarely practice what I preach on this, but I know what the right thing to do is, and that is before you go to bed, we're not advised to sit and watch TV. A better, more comforting thing to do would be to dim your lights, maybe read a book, sit in another room and read a book, and then come inside. Don't have a cup of coffee too close to going to bed. Set your stage, set the mood, maybe some peaceful music. And sleep is so important because what sleep does, that's when our body heals itself. So if you're never getting into a deep sleep, the REM sleep, the rapid eye movement sleep, your body is not healing to the extent it can. So don't underestimate the value of sleep to help you avoid feelings of anxiety, depression, and even physical illness. You can do deep breathing, meditating, and imaging. I do that all the time. You can do that and nobody even has to know you're doing it. Relaxation breathing is a breathing that you do abdominally. And when you're doing abdominal breathing, most of us when we breathe, it's our chest rising and falling. With abdominal breathing, you want your abdomen to rise and fall. And the way you can feel that is to put your hands on your abdomen. It is so relaxing when you get into that deep rhythmic breathing. Meditation is simply kind of closing your eyes, thinking about something pleasant, putting yourself somewhere else in time or place. When I do kind of meditating or imaging, I like to put myself in a field of flowers or lying on a beach where you can hear the water coming in and out. You can smell the salt water. In a field, you can smell the flowers. You can hear the wind rustling. That's the level of intensity that you want to get into in the imaging. And it can be extremely relaxing. Another thing that I recommend all the time, I've taught it, and I use it, is aromatherapy. You can pick up these oils. The ones that I particularly like for relaxation are lavender, sage, and grapefruit oil. They are extremely relaxing. We actually did this on one of our units when I was a director of nursing. One of our nurses wanted to try lavender on the unit where she had a lot of agitated patients, and there was a very definite difference between that. So it's such a simple thing to do. You can put it on an oil just and smell it. You can put it in a hand lotion and do a hand massage along with it, which is tremendously comforting, especially if you're alone. One of the things about being alone is nobody touches you. And I know I crave that. I mean, we're not holding hands, we're not touching people, we're not hugging people. So you can hug yourself. You can give yourself a hand massage. The other thing that's so important is eating and drinking adequately, that you maintain a balanced diet, that you drink adequate fluids. All of those will help you stay refreshed, your system in order. It helps to avoid anxiety and depression. And then I would be remiss if I didn't talk about medication. People who need medication to get through anxiety or depression should never feel distressed about taking it. It would be a temporary measure. And here we're talking about the kind of depression that one might have in a COVID-19 situation, where you're feeling isolated and alone and lonely and depressed and things of that sort. And medication can help you through that if you need that. With COVID-19, the link to social isolation is so strong because we are, in fact, isolated. People who live in residential care facilities, nursing homes, congregate living, assisted living facilities, are indeed isolated, and they're cut off, in many cases completely cut off for months here, from their family members and support. Even at the end of their life, when people have been dying, people have been cut off from the loved ones who give us support. And it's your nurses and other people in the hospital who are being the surrogate loved ones, holding people's hands and talking to them, because we recognize how important that social contact is. Isolation and loneliness are so highly linked to those who have poor physical and mental health, not only in the COVID era, but in general. Residents in facilities are cut off from social activities. They can't go to recreation activities like you would normally have wonderful recreation activities in assisted living facilities and nursing homes, but here you don't have it. The places of worship, a source of tremendous strength to people, is often shortened. You're cut off from friends and loved ones in person-to-person reactions, but we did talk about all the other ways you can maintain that. Social isolation and loneliness has so long been overlooked and not evaluated sufficiently during assessments of seniors. And I should have said at the beginning that in addition to being a nurse, I have 2 degrees in gerontology, so I know full well how important the people who work with the elderly, how important it is for people to understand the differences in older people. Babies have different reactions to things, seniors have different reactions, teens have different reactions. We're different because of the different phases of life we're in. But not assessing a senior for isolation or loneliness is a big disservice. So if I'm talking to a provider out there, please add that in when you're doing that. So it's important here now to look at who's at high risk for social impact or social isolation impact. And aside from the ones we talked about where you might reside, if you are a person or you're working with a person or living with a person who has sensory deficits or cognitive impairment, they're even more socially isolated because either they can't hear you or see you, or they don't understand what you're saying to them, or the cognition is impaired in some way. We have loads of people in our country who live with mental illness every day, and people with mental illness are another group who are often isolated, not only during COVID-19, but a lot of the time because we have so much negative thinking around mental illness, the stigma of mental illness. Another group who's socially isolated are the people who are caring for people who need care. People in the nursing homes, the assisted living, the congregate facilities, the home care staff, and the family caregivers. So these are all people who also have a lot of high risk for social impact. I wanted to stress that there is such a big difference between being alone and feeling lonely. They're 2 totally different issues. As I said before, one can be alone in a crowd, or one can be alone and remain actively engaged. And if you look at the slide, I tried to put a whole bunch of different things in there to show you that there are so many ways you can remain engaged. We have exercise groups going on through the computer. We have poetry groups of people who write poetry and share it over the telephone, through computers. We have people who do their own painting. We have people who develop hobbies, journals, all kinds of things people do and they share. So don't be lonely in a crowd. Reach out and make yourself a part of another group. I wanted to talk a bit about coping mechanisms, and that's part of what we've just been talking about. Connect virtually with all these people. Use the technology and social media. Another thing is to avoid overwatching and reading the distressful news that's altered our way of life. I could be glued to the television from morning till night, and my husband sometimes has to remind me, you've watched it enough, because I'm tearing my hair out over things I'm hearing. Don't do that to yourself. Pull yourself away, take the walk, close it down. If you stop and think about it, we're hearing almost the same thing, show after show after show. So do you really need to watch it 20 hours a day? Okay. Another important thing is share how you feel with others you trust. Let people know how you're feeling. There are so many compassionate people out there. Take advantage of grounding exercises like I talked about, the meditating, the deep breathing, the imaging, the journaling, yoga, hobbies. And a great one is engage with your pets. In all kinds of places, we actually have pet therapy. If you have a pet, you're so far ahead of the game because they're right there with you. And I know I have 2 dogs, and they're a tremendous comfort to me. Here are a list of helplines for people. They're going to be up here on your screen. You can call 911 for emergency help. You can call 211 for information resources. They offer these in multiple languages. There's actually a distress disaster helpline, and we have the number there for that. Okay. Domestic violence has increased dramatically during the COVID-19 era because people are locked in tight quarters. And if you have friction, sometimes that friction goes beyond. If there was already a problem, it may get worse. So we have included here the National Domestic Violence Hotline. We have the Veterans Crisis Hotline. We have the Regional Mental Health Center and the Franklin Du Bois Center, which falls kind of under that. You have a branch right here in New Canaan. And then I have other helpful resources. The area agencies for aging are all over the country, but right here covering this area is the Southwestern Connecticut Area Agency on Aging, which I know so well because I'm on their board. Wonderful organization. You have the Elder Care Locator. If you're looking to find free assistance, we have the National Council on Aging, which actually has programs you can tap into. We have the AARP, which has a program called the Community Connection Tool. AARP provides all kinds of information for seniors and people who care for seniors. Okay. And then I just included some references of where I got some of my information, my most current information. I think almost all of these are the 2019 to 2020 resources, so they're all current. So my message to you is don't be alone. Don't feel lonely. Reach out to people. You can reach out to strangers. You can reach out to people you love and care about. But don't be alone. Everybody is out here. We're all in this together, and we're going to come through this together. Thank you for listening.
We've just heard Dr. Palmino talk to us about the value of social connectivity. And that social connectivity is certainly important in this new age of isolation. And we're all impacted by the isolation one way or another. The good news is, as Dr. Palmino has shown us, is that there are a wide variety of resources we can take advantage of, as well as many available resources to us locally. And I encourage you to take advantage of all of them.